talk about the malignant epithelioid mesothelioma and its effect, prognosis, treatment, and its types. So basically, epithelioid mesothelioma is a cancer subtype caused by the asbestos. It is most common mesothelioma cell type, accounting for 50 to 70% of the cases. What is epithelial mesothelioma? Epithelial mesothelioma is the most common of the three cell types of the mesothelioma cancer. This tumor cell type involves the cuboid cells with low mobility that group together and have visible nuclei. Epithelial and epithelioid both refer to this type of the asbestos related cancer. More than 50% and up to 70% of the mesothelioma cases are epithelioid. Epithelial cells line the portions of the airway known as the bronchus, an area susceptible to asbestos inhalation. The respiratory tracking lining consists of the pseudostratified columnar ciliated epithelial, which serves as the protective barrier. Patients with the tumor cell type live about the 6 months longer than the patients with the other cancer cell types. It has the best prognosis of the three mesothelioma cell types because it is the most responsive to treatment. Now the characteristic of the epithelial cells. The epithelial mesothelioma cells clump together in a group. Each cell is square, cubed, columnar, long, or the squamous, flat in appearance. The nucleus, the central cellular region that contains the genetic material is noticeably visible in each cell. Because epithelioid cells lack the mobility and adhere closely together, they are less likely to spread and metastasize the sarcomated cells. This characteristic is one of the reasons epithelial mesothelioma has a better prognosis than the other cell types. Symptoms of the epithelial cell mesothelioma. Mesothelioma symptoms remain the same regardless of the cells that make up the tumors. Tumor cell types primarily impact treatment response and the growth rate, but they do not influence the symptoms. Epithelioid tumor cells do not cause the symptoms different from the other cell types. So guys, the symptoms of the mesothelioma, malignant epithelioid mesothelioma includes the shortness of breath, means the breath is very much short, persistent, non-productive dry cough, hoarseness, coughing up blood, low blood oxygen level, anemia, low iron, fever, night sweats, weight loss, feeling full even without eating, lack of the appetite, and nausea, fatigue, and extreme condition. Prognosis of epithelial mesothelioma. Mesothelioma diagnosis is the diagnosis of the epithelioma and the